We have the stretchers, the cardiac monitors, and so when we have patients, the first thing we're going to do is we're going to put them on our cardiac monitor. We're going to get blood pressure, we're going to get a pulse oximetry, we're going to look at our vital signs, we're going to look at the injury, the severity of the injury, and so forth. And from our initial assessment, initially first talking to the patient, we're going to start thinking what their injuries are and then what is the most appropriate facility for us. Here in Northwest Arkansas, we have great hospitals that all have pretty equal care, and so we basically are able to ask which is your destination of choice and so forth. But for those patients that are special, we carry these little bands. I'll show you here. The state of Arkansas, we have these trauma bands. And so these patients will get a trauma band with a patient-specific number. What that allows us to do is to push that on every trauma patient. Every trauma patient will get that trauma band, and then we're able to type our charts to hospital charts, and then we're able to contact the Arkansas Trauma Communication Center, and they're able to look at what they call a dashboard and see what hospitals have what services. So we have a patient that has a pelvic fracture. You know, pelvises are one of those specialties that really aren't taken care of here. A lot of those have to go to specialty centers. So we can then contact Arkansas Trauma Com and say, hey, we have a patient with a potential pelvic fracture. They're able to say which facilities are open, what facilities you can transport to, and they can even help arrange transport. We can go from the scene if needed to actually send those patients by air, or establish where we're getting that patient, how we're going to get them there. So it helps increase the patient care in the long run. So that's a great thing that we have in our trauma system, is the Arkansas Trauma Com Communications. You know, and they come to meetings, they're involved with the hospitals and designations and so forth, and it's absolutely fantastic. So in our lids, we carry decompression needles. You know, we have decompression needles, and so they look pretty barbaric, but if you have a patient that has a chest injury, that has a pneumothorax, and the lung is losing inflation, the pressure on the outside is greater, we have to decompress that. And so we're able to get our decompression kits out. We're able to reach out to hospitals and have surgeons come in and confirm our placement's good and teach us how to use this stuff, so we can, you know, outreach into the community with care. So we have decompression needles. But as we started doing our drills with Northwest and doing these mass casualties, we had just one trauma bag. We have one trauma bag, and you've got 15 or 30 patients inside. It's hard to get this one bag with 2 staff around. So one thing we identified that we needed to do is we needed to have a plan for a mass casualty incident. So that actually led us to developing a new bag, which you put it over here. I'll show you. So doing these drills has kind of taught us how we need to step up and do things better. So now what we do is we have that trauma bag. It's going to go to like the casualty collection point. At that point, that's where we're going to decompress chests and so forth. But we have this bag. Each ambulance has one of these bags, and in this bag there are pressure dressings. This dressing is able to have gauze in it. We can pack a wound, we can put pressure dressing on there. Each kit has tourniquets in there. So each bag is set up to take care of. It has 5 tourniquets, 5 pressure dressings, and 5 rolls of Kerlix in it as well. And so we're able to move these, and it has chest seals. So we have a patient that has a chest wound, we put a chest seal on there. If they're bleeding actively, we can put a tourniquet on. If we can pack it and wrap it with a pressure dressing, we can do that. So this